like to welcome you all. And thanks to GSMA and mHealth Alliance for providing us this challenge. So, from the beginning of this summit, we are all discussing who is going to be owner of the service, who is going to pay for the service. I guess this session is going to create an answer to that, because now Marta and I are properly in different sides. Marta has explained something on rural, which needs to be supported by the government, which needs to have funds, which needs sustainability. And now I will be presenting you the ones who's providing by themselves. But before starting, I would like to give you small information about our healthcare group. So I'm from Turkey and Acıbadem Healthcare Group. We have 9 companies binded into healthcare groups. So starting from LabMed, we are providing all our laboratory services on the hospitals by LabMed, as you can understand from the name. Acıbadem Sigorta is Acıbadem Insurance Company, and Acıbadem Healthcare Group is the only healthcare group who owns its own insurance company in Turkey. A+ is our catering, hygiene, and cleaning company. And hospitals and outpatient clinics, we have more than 20 hospitals wide around Turkey working. And the number of outpatient clinics is 19. And number of patients we are receiving per year is more than 3.5 million. And we have our advertorial company. Our project management is construction company. They are constructing our buildings. And we have university. You know that it's basically medical university. The pro is coming from insufficient staff. So we are training our own staffs. And Lab Vital is for food industry and food laboratory. And finally, here we are, Acıbadem Mobile. We have nothing to do with the mobiles, but we are mobile. We are moving everywhere, so that's the reason the name is mobile. All our hospitals are JCI accredited. Those who are related with the healthcare probably knows it's one of the major accreditations. And regarding Acıbadem Mobile Healthcare Services, let me just quit this. Acıbadem Mobile Healthcare is providing health services at site, except surgeries. We have home health care, mother cares. Our nurses are going to homes after having babies, and they're teaching moms how to wash them, how to treat the babies. And we have ambulance services, both land and air. We have a medical call center working 7/24 with doctors inside. So today, the reason I'm here is Mother's Platform. It will start from pre-pregnancy to mother and child phase. Why Mother's Platform? Because here you can see the number of births. It's for Turkey, and more than 1 million births are given every year. It was a must to reach to those populations. And it was a matter of priority. We have to decide to launch one from first of all, because we can also have launched the chronic disease management that we are taking care of. But when talking about chronic disease management, people is trying to stay away of that. If you say your patient that, have you made your measurement today? And you know what? They're unsatisfied. Would you please leave me alone with my diabetes? I do not want to hear every day that I have to measure or not. 10% of our patients don't want to be heard words about their illnesses. So to have us succeed on a project like that, we first launched Mother and Baby Platform. I would like to give you some information about the technology in Turkey. So in 2010, number of internet users was 35 million. And by the way, the population of Turkey is 75 million. So almost 45% was using internet. And this does not include those who are connected from their mobiles. This is only from PCs. And here are informatics technology ownership. You can see the dramatically increase. And in 2010, number of cell phone users are 90%. So almost everybody has cell phone in Turkey. Why do I put this slide here? And when anybody has illness, get cold, flu, what we are doing? Googling. And when we are Googling, unfortunately, we are finding some informations which we don't know where it comes from, which we don't know if we can trust to it or not. So it was a must for us to have drsanson.com, which is a health-based platform. All the information, all the contents are provided by our doctors, which is scientific, which is approvable, and which is trustable. And Mother and Baby platform is a part of it. So in Mother and Baby platform, we have both website and mobile application. Although if you can reach from your mobile site to the website, it's almost the same thing. It's again mHealth. So it's really, there are no borders between mHealth and eHealth, for me, second to me. We have plenty of information in that, which is useful for mothers and parents, not actually mothers. Starting from the pre-pregnancy, so you have the menstrual cycles there. You can calculate your pregnancy terms. If you want to give a birth to a baby or not, you can control yourself. And you have the baby growth charts. If you can click on the numbers there are weeks. The content comes inside. It's regarding the weeks. You have the specific contents. And with SMSs and MMSs, mothers are having personal contents. If you're in 34th week, you're having information for 34th week. So we didn't want to make a really dark medical stuff. We wanted something pleasant too, something enjoyable too. So we have name trees. I guess most of you are already parents, and most of you know the difficulty to finding a name when you're in pregnancy. So we have just providing name trees, just to give an idea. We're not forcing anyone to use the names, of course. So this is basically the idea was to create some social networks, some useful informations, and even the ultrasonography videos are able to be shared. It's again remote. You're just taking your laptop with a USB entrance ultrasonography, and you're able to send your data again here. The ways to reach the information in our platform are, of course, web, SMS, MMS, and iPhone, iPad. Does anyone has any idea why iPhone and iPad? Of course, it's the best seller in Turkey. The sales team of iPhone and iPad work better? No. What we have decided, the best solution is to start from somewhere, not to have all the solutions at the end, because when you're trying to find the perfect, you're losing the job, you're losing the business. So start from somewhere. Give a chance to the project. So we have started with iPhones, which is easy to access to the application, which has nice graphics that you can see it, and which is standard. If you're using iPhone 1 and turn back to iPhone 4, you can again use the same applications. You don't need anything to do it. But if you change your cell phone, generally, the applications are gone. So iPhone is preventing it. The contents are our own contents, as I said. And I would like to thank our team. Here we can find the names. I will be having all your questions. Thank you.